Okay, I'm back. I'll show you a different view. I'm in my office at the farm. This is where I see patients. Give you a tour of my office. That's where I sit. Kind of boring back there, so I changed the view for you. You can't see, but it is snowing outside, so I'm feeling better about my decision to video lecture. Anyway, had a little bit of sugar, and I am ready to go. Okay, pH. So what do you need to know? All that stuff at the beginning, the first few slides on pH, man, you need to know that stuff. If you don't know that, you got to go back and read. Not a big deal. So you can easily figure that out. What's important? So that last slide on page 7, well, it's page 7 for me, but I don't know what it is for you. It's a slide that says, there are 4 slides that say pH is the third one. Acids are formed as end products of protein, carbohydrate, and fat metabolism. So, in your body, as a result of normal metabolism, your body produces acids. All different kinds of acids. Carbonic acid, sulfuric acid, phosphoric acid, all kinds of normal metabolic acids. As a result, your body has to get rid of those. How does it get rid of them? It has to use the kidneys. Okay, the kidneys excrete acids. But if there's a problem with your kidneys and your kidneys can't get rid of that acid, then your lungs have to get rid of a different kind of acid called carbonic acid. It does that by excreting CO2. CO2 is equivalent to carbonic acid. It's not the same thing. It's just when you blow off CO2, you're getting rid of the amount of carbonic acid that's in the body. You're actually blowing that off in the form of CO2. So it's a way that the body can get rid of acid when the kidneys can't work, and vice versa. Because in the normal expiration inhalation process, we get rid of CO2 if there's a problem with the kidneys, with the lungs, and you can't blow off or get rid of, or you blow off too much CO2, which is potentially carbonic acid, the kidneys have to adjust. They either have to increase their excretion of acid or decrease their excretion of acid, meaning hydrogen ion, in order to compensate. So the kidneys compensate for the lungs. So the two work hand in hand. I hope that makes sense. So our body maintains a very narrow range of hydrogen ion concentration. As we're normally throughout just doing our thing, or if we're exercising, we're increasing lactic acid buildup. So we're increasing acid. What do we have to do? We have to get rid of it. We have to balance that amount of hydrogen ion, and we have to either do that with the lungs or with the kidneys. Those are our buffering systems. And so you have a very narrow pH range of which you can normally function. The bones, the lungs, the kidneys are the major organs involved with that buffering system, and you can take a look at those buffering systems in your book. At that next slide, So body acids exist in two forms: volatile, volatile meaning that they are not stable; they're easily go into a gaseous form. That's H2CO3 or carbonic acid, eliminated as CO2. And then the sulfuric, phosphoric, other organic acids are non-volatile, and those are, as I said, excreted by the kidneys. Let's see here. So oxidation of sulfur containing amino acids, oxidation of phosphorus containing nucleic acids, oxidation of glucose causing lactic acid, oxidation of fats causing keto acids. All those things are parts of the metabolism of acids, and then also in terms of bases, metabolism of citrates, lactates, acetates, aspartates, glutamates. Those are all more of a basic, have more of a basic influence, causing more bases. So we have this balance of acids and bases that we have to maintain. And when and we have different organs in the body that help to maintain that. So that's where, if you look at the buffering systems on the next page, or on the next slide, sorry, that helps to explain that. Now, in the blood has the ability to buffer some acid, and that happens within seconds. The blood can absorb hydrogen ion or bicarb. It can adjust pretty easily. Respiratory, so blowing off or either increasing our respirations, getting rid of CO2, or holding on to CO2 to increase our acid. That's a compensation that happens within minutes. That's a fairly quick buffering system. The renal excretion of acids of hydrogen ion or bicarb, which is the base, that happens in usually hours. So that's a slower compensatory response, a slower buffering mechanism. The carbonic acid bicarbonate pair, that is the acid-base pair in the body, and that has to be maintained at a ratio of 20 to 1, 20 bicarb to 1 carbonic acid, which puts it at a pH of 7.4, which is exactly where it needs to be. That has to be maintained, and when the body increases acid or decreases base or whatever, you have to quickly respond by the plasma, the respiratory, and the renal compensatory buffering systems. If the amount of bicarb decreases, that next slide. If the amount of bicarb decreases, so you have diarrhea and you lose bicarbonate, you lose base, so you're going to become more acid. The pH drops, and that causes a state of acidosis. The way to compensate for that is to change the carbonic acid, to decrease the carbonic acid. And one way to do that is to blow off CO2, which blows off carbonic acid, and therefore causes a buffering or a buffering of that acidosis, acidotic condition. Okay, so then the next slide, the respiratory system compensates by increasing or decreasing ventilation, and the renal system compensates by producing acid or alkaline urine. Quickly going over to acidosis and alkalosis. 4 categories of acid-base imbalance. respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. So a respiratory acidosis happens as a result of something with our lungs. It's a respiratory issue. Our lungs are compromised such that we're not blowing off CO2. We're not respirating very much. Our breathing is shallow. What would cause us to have shallow breathing? You might anticipate that that could be a brain injury, or that could be some sort of a drug that we've taken that has slowed the central nervous system, and we're holding on to CO2, and therefore we're getting a respiratory acidosis. The compensation, the lungs, if the lungs are compromised, the kidney has to kick in and compensate. In a condition of a respiratory alkalosis, anxiety, for example. Oh my goodness. Some of you may be familiar with that. What happens is we're blowing off CO2. We're ending up in an alkalotic condition. It's as a result of our lungs, or it could be as a result of a brain injury causing an increase in respirations, or some sort of a lesion in the brain telling us to breathe more often than we should, and that causes a loss of CO2, and therefore, again, the kidneys are going to have to compensate if the original issue is not solved. And a metabolic acidosis. Metabolic acidosis is a metabolic condition. The body is producing too much acid. Common one, diabetes. Ketoacidosis. As a result of diabetes, a loss of available sugar. The sugar is out there, but it's not usable in the cells, and so your body has to break down fats, ketoacids, and those ketoacids are going to increase the acids in the body, and your body has to compensate with the lungs. So as a result of increased metabolic acids, you have to get rid of another type of acid. You get rid of carbonic acid, a volatile acid, by blowing it off, blowing off CO2. We'll talk quite a bit about metabolic acidosis throughout the semester as a common imbalance. And a metabolic alkalosis. So this is a relative increase in bicarb. What would cause an excess of bicarb? What would cause your body to hold on to bicarb? Well, diuretics could do that. If you're they're going to change excretion. Sorry, I was looking at something. A hyperaldosteronism. So as I mentioned earlier, Cushing's conditions will cause a sodium and bicarb retention, and therefore cause alkalosis. And then vomiting. If you're vomiting, you're getting rid of excess chloride, which is an anion. If you're getting rid of an anion, your body has to hold on to another type of anion. So if you're getting rid of chloride because you're vomiting hydrochloric acid, your body has to hold on to bicarb, another type of anion, to maintain that negative charge. And so in the next slides, you can take a look at those conditions. So metabolic, in a case of a metabolic acidosis, so you were normal, and then you had a condition which caused a metabolic acidosis, and then your lungs will blow off CO2, and then your response is that the kidneys are going to hold on to bicarb, and they're going to eliminate hydrogen ion. That's what that first slide says. So a metabolic acidosis is a condition that causes a relative excess of any acid, but carbonic acid. Carbonic acid is more associated with the lungs. So it's a condition where you're making or holding on to too much acid. So a lactic acidosis. So if you have poor circulation, poor oxygenation, you're not getting lactic acid flow out of the body, and therefore you're holding on to acids. Renal failure. So if you have kidney failure, you have a lack of hydrogen ion excretion, so you have a relative increase in acid. That's going to cause a metabolic acidosis. And again, diabetic ketoacidosis is another major cause of metabolic acidosis. As a result of all that acid, the symptoms: headache, lethargy, Kussmaul respirations. Kussmaul respirations are just increased deep respirations, like you running up the stairs. You're going to get Kussmaul respirations. You're trying to compensate and trying to get more oxygen in. But the symptom for a metabolic acidosis is your body is just going to start blowing off CO2, carbonic acid, because it's built up too much other types of acids. And then also another issue with excess acid is, remember that in an excess acid condition, your cells will increase the amount that they're retaining hydrogen ion. As a result, they're going to dump potassium. Remember, we talked about that. They're going to get rid of potassium. The potassium is going to go out of the cell into the bloodstream, and the person is going to become hyperkalemic. Remember, when they become hyperkalemic, they're at extreme risk of arrhythmia and cardiac arrest, cardiac arrhythmia. Let's see. Okay, in a metabolic alkalosis. So we're going along, we're fairly healthy, and then something happened. We were excess vomiting. You got that hyperaldosterone, diuretic. Something caused either a loss of acid or an increase in bicarb, and therefore you're now alkalotic. The compensation is the lungs are going to suppress their breathing to hold on to carbonic acid to balance those other acids that were too low. And so the kidneys are going to conserve hydrogen ion, and you're going to get a loss of bicarb. So symptoms of weakness, cramping, hyperreflex. So again, you're in the situation of an acidotic condition, you had a lethargy and a decrease in reflexes. In an alkalotic condition, you're going to have hyperreflexes, shallow respirations, because you're trying to hold on to CO2. I have a note here. Renal compensation is less effective with vomiting due to the loss of chloride stimulating the renal bicarb retention. I'll have to think about that one. You might think about that one too. All right, respiratory acidosis and alkalosis, and then I'm maybe going to be done, I promise. Okay. So we were healthy, normal pH balance, and then what happened is we had a head injury. We were taking barbiturates. We had a chest wall injury. We went snowboarding and we broke our ribs, and Now we're not wanting to breathe because it hurts, and so you're actually not blowing off anything because you don't want to breathe. Or you have multiple sclerosis or myasthenia gravis, something that causes respiratory muscle paralysis. Or you have a disease in the lungs, and the lungs aren't working. They're not able to blow off, and therefore you're holding on to CO2. If you're holding on to CO2, you're holding on to carbonic acid. The compensation for that is the kidneys are going to have to eliminate hydrogen ion and conserve bicarb. And then you can read the symptoms there. Respiratory alkalosis. Again, that's that anxiety where you have that deep respirations. A hypoxemia. So if the lungs are not working properly, you're still going to be gasping to try to get more oxygen in, but what's also happening is you're blowing off CO2, and that's going to cause a respiratory alkalosis. Heart failure, your heart's having to work harder. That's going to cause a hypoxemic condition. Anemia could cause that. Altitude, any of those things would cause a hypoxemic condition, cause a respiratory alkalosis. Hypermetabolic state, so fever, anemia, I think I already mentioned that one. Thyrotoxicosis, so this is when your thyroid is working too fast. Everything is moving at a rapid pace. People who are extremely hyperactive thyroid, hot, their body's going really fast, kind of looks like me. They're going to be blowing off too much CO2, and they're going to end up with respiratory alkalosis. Or the improper use of ventilator. That naughty nurse who wasn't paying attention in pathophysiology class didn't set that ventilator right, and that person is blowing off too much CO2, and they're ending up respiratory alkalotic. As a result, your body has to compensate by holding on to bicarb or dumping. Holding on to hydrogen ion or getting rid of bicarb. Symptoms of that blowing off, well, try it once and see what happens. You'll get kind of that dizzy condition, that dizzy, and long term you get that confusion, convulsions possibly. All right, there's a lot to read here. And I expect that you're going to be able to do that. It's nothing difficult, but make sure that you're reading. I did not hit everything, so I would say that if you maintained everything that I've gone through in this last hour or so, hour and a half, you're going to be in. If you know everything I went through, I'd say you're guaranteed a B on that exam, just about. If you don't, then you need to go back and study. And then, again, you have to know more than what I just went over, but I just hit the highlights. Okay, good luck, everybody. I'll open that test. I'm not exactly sure. You can take a look at the test and see when I opened it and then when it is due. I imagine I'll have it due. Maybe I'll have it due Sunday night. I think that's probably what I'll do. All right. Good luck. Bye-bye.